Welcome to the National Fellow Online Lecture Series sponsored by the Fellows Online Education Subcommittee, the Education Committee, and the Fellowship Committee. Today, we are speaking on sexual violence in sport. We have two speakers, Sherilyn DeStefano. She is in Portland, Oregon at the Oregon Health and Science University, and Jennifer Koontz, who is at Newton Medical Center in Newton, Kansas, which is close to Wichita, and she also has an academic appointment at the University of Kansas School of Medicine. My name is Melody Hrubes. I'm at the Hospital for Special Surgery in New York City. Next week, please join us for Emergency Action Plans. It is also on Wednesday, September 18th at 8:30 p.m. Eastern Time. Our speaker is Robert Flannery, and our moderator is Dana Shang. The goals of this lecture series are an adjunct to your home program's educational content to provide fellows with direct access to educational experiences with AMSSM members and at times invited guest experts, and assist in CAQ exam preparation. There are rules. Please mute your device's microphone and turn off your video. Submit questions through the chat function. The moderator will ask the questions during the Q&A at the end, and please complete the evaluation at the end of the lecture. We do want your input. If there are topics or speaker suggestions that you feel would really be helpful for you, especially with your CAQ preparation, you can go to amsssm.org. You can follow these links here, or I'm going to show you a QR code in a minute. If you miss this now, and you're welcome to just hop on and take that picture or get to your phone. If you miss this lecture will be up on YouTube in a few days. So you're welcome to listen to this again or listen to any of the ones that have been on in the last few weeks. There will be a QR code. And with that said, I'm going to stop sharing. And Dr. Koontz is going to lead us off. So I'll turn that over to her.
Thank you so much, Melody. And it's great to be here with you tonight. I'm just going to start off by giving a little bit of background on AMSSM's and advocacy involvement in sexual violence in sport the last few years. Like Melody said, I am a sports medicine physician in Central Kansas. My primary board is family medicine, and I currently serve as the treasurer of AMSSM on the executive committee. So this is my second year doing that. In the past, I served as practice and policy board chair. And in 2019, I served as the chair of our sexual violence in sport task force that we developed. And I think we're going to share the slides. So I will do that. So I just want to start off by saying I'm really glad for your involvement in watching this this video and this lecture. It's very important that we as physicians always advocate for our patients and for our teams that we're involved with. So this is a great opportunity to learn more about how to do that. It's not always an easy topic to discuss or know the exact move to do. So this is part of our ongoing efforts to help us all be better advocates for prevention of sexual violence, as well as advocates for survivors of sexual violence. So this is just a little screenshot of the position statement that was published in 2020 by AMSSM that outlines goals that we have as an organization that involve sexual violence in sport. Chad Carlson is a physician who was AMSSM president in 2019. And he viewed this as a very important topic, so made a special presidential task force to figure out our best approach to this issue as a society. And so I was the chair of that task force, and it involved 22 members, mostly sports medicine physicians, but also representatives from National Federation of High Schools, NCAA, CDC. We have a social worker and several legal experts on that task force. So it was a really good experience. We did we did a lot of important work coming together to form what we see as the problem and also our next steps to take to address it. And then that resulted in a position statement that was published in the Big Four sports medicine journals in 2020. We also worked with Safe Sport to help create a health professions education module, sorry, excuse me. And some of you may have taken that or will have a chance to get to take that. It's available to all physicians, but physicians that are part of USOPC um, may have been presented that in a more formal way. And I just want to say that Jeff Tanji is a sports medicine physician who's been a leader in AMSSM for many years. And a lot of this important work started and was inspired by him, who gave a very important lecture at an AMSSM meeting a few years ago that just emphasized that we cannot be silent on this matter and we must be proactive. So I just want to really thank him for his leadership. And so I wanted to just go over a couple minutes. The Presidential Task Force transitioned into a subcommittee that is officially under the International Interorganizational Relations Committee. And and so that subcommittee is now formed. If you want to be a part of that, please let us know. Um, we can put our contact information in the chat later, but you could always send me an email. And I am chairing that subcommittee for now, and we are starting to do a lot of great work. And we have various goals that are ongoing and for the future. But our main goal is always to support and advocate for survivors of sexual violence in sport. And so we always want to keep survivors' voice front and center of everything we do. A big topic that we want to take charge of is educating AMSSM members, including fellows, of course, about sexual violence in sport. And there's a lot of different pieces to this that can become really complicated, but it's not only preventing it in terms of making sure policies are in place, educating our athletes about identifying grooming behaviors, things like that, but also recognizing when someone's been a victim and then becomes a survivor of sexual violence in sport. There are things we can see in clinical practice that can give us clues to inquire about this. And then understanding our role in a multidisciplinary treatment approach. And really, the biggest thing that paralyzes a lot of people are all the legal questions and legal implications. Confidentiality is, of course, a topic that we take very, very seriously as physicians. And so understanding our role in confidentiality, as well as reporting, when can we report, when can we not because of confidentiality, and then also, of course, always holding our peers accountable. And then as part of IIOR, one of the things we emphasize is that we want to continue to build relationships with other organizations that are also interested in this topic. And then we want to make sure over time that we find ways to incorporate this into our clinical practice, teaching our patients and athletes about their right to a safe exam and how to advocate for themselves so they feel safe. And then we're also currently working on incorporating a screening question into the PPE that would impact a lot of athletes in our country. And then finally, I just wanted to say ongoing research is very important. If any of you have research projects or initiatives that you want to use or that would involve this space, please reach out to us and we can help support those efforts. The CRN is currently working on research project with a group called the Army of Survivors, and Sherilyn and others are coordinating an effort to do a Delphi panel for creating an emergency action plan regarding sexual violence in sport. So I just wanted to give you a little background, and I'm really thankful for Sherilyn to give the rest of this talk tonight. And we'll kind of watch the chat box to help with any questions. And like I said, I'll share my email, so reach out if you have any questions. So thank you so much.
Thanks, Jennifer. So let's see here. I'm just gonna, can you still see the right screen there?
It looks great.
Great, awesome. So as Melody introduced earlier, my name is Sherilyn DeStefano. I am faculty at Oregon Health and Science University in Portland, Oregon. I'm so sorry, let me close that. And I practice there. I have a practice that's sports medicine, as well as full spectrum family medicine, including obstetrics. And I have a particular interest in women's health. And I became interested in this topic of sexual violence in sport during my fellowship, really because it sits at that intersection between primary care and sports medicine and gets at the question of how do we, as sports medicine physicians and oftentimes team physicians, help ensure that we're taking the best care of our athletes as people first and foremost. So it's really an honor to be here today and talking to you on this topic. I do want to start with just a trigger warning that there are going to be some sensitive content that we're going to talk about and talking about various different components of sexual violence. So if anyone is feeling triggered by the discussion today, there are various different resources that you can reach out to. And I encourage you to take a look at these resources, even if that is not the case for you, so that you know them in the future if you are helping to support someone who has experienced sexual violence. Sexual violence is something that we've seen come up a lot more in the media and has been happening, unfortunately, for years, but it is now coming more to light, and it happens across many different sports. It affects both male and female athletes. And there are many occurrences, of course, that are not publicized and that don't come to light. And athletes have been expressing frustration with organizations, with sporting organizations, and within even sports medicine communities and law enforcement communities, with concerns that even when they bring their concerns to organizations, that they're not being taken seriously, that nothing is being done as a result of that. There are also concerns that the questions about sexual violence in terms of asking if that has occurred or doing screening for this may not be occurring, or even if it is occurring in a healthcare setting, oftentimes it's being asked in a way that is more of checking a box rather than asking out of pure concern. And so I'm so glad that you're here today so that we can try to take steps to improve how we are approaching this as a sports medicine community. And as Jennifer mentioned, Jeff Tangi was really the one who had a very inspiring talk at the 2019 AMSSM annual meeting, which was my first AMSSM annual meeting, where he spelled out the ways in which, unfortunately, in the sports medicine community, we have broken trust with athletes because of various occurrences of sexual violence in sport, and the work that is ahead in order to rebuild that trust and repair that broken contract. And so that is part of what we're doing today. As I mentioned before, as sports medicine physicians, we have the honor oftentimes of being team physicians. And as team physicians, we are often seen as the leader of the team. And that can involve many different components. That can include medical components of athlete care, both physical and psychologic. That can include ethical components, thinking about various different potential conflicts of interest, different competing priorities, and trying to keep what is right at the forefront. And then there are also a number of medical legal components as well, and thinking about, as Jennifer mentioned, confidentiality laws, various different regulations, and various different organizational rules in place. And in an upcoming update of the team physician consensus statement, there will be specifically called out the responsibilities of team physicians and how their responsibilities here relate to harassment and abuse. And as Jennifer went through, the AMSSM position statement published in 2020 does call upon sports medicine clinicians to develop competencies around sexual violence. We're going to go through a number of these today, and this is being used as a place that our subcommittee is continuing to use as a jumping off point to build further education around this topic. So by the end of our conversation this evening, I hope that you are going to feel more confident in your understanding of what sexual violence is and how you can feel more confident helping those who have experienced it. I've got two objectives for you that have to do with broader pictures, mostly around acknowledging the importance of education around sexual violence in sport, and then also recognizing how you as an individual can commit to being part of changing the culture around sexual violence in sport. We'll also get into some of the nitty-gritty about what encompasses sexual violence and being able to identify potential risk factors, both environmental and behavioral, and how to mitigate those, and know what steps the sports medicine team can take to prevent, identify, and respond to sexual violence. And why is this important? Well, we went through already that a lot of athletes are frustrated that there's not more emphasis around this. And so we have a duty to our athletes to do this. But in addition, we know that early intervention can decrease the chance for ongoing abuse and can decrease the chance for adverse long-term effects. It is also true that many survivors are not going to seek care specifically for sexual violence. That may not be in their chief complaint when they come see you. And so it's really up to us to have that at the forefront, continue to have a high index of suspicion for that, and be asking the right questions to unearth that if that has occurred. And it's also important to note that that disclosure experience, if someone chooses to trust an individual and share that information, that can have a very positive, hopefully, or potentially negative effect on survivors and their likeliness of seeking care in the future and their potential trajectory after experiencing sexual violence. So, what is sexual violence? It's an umbrella term. It encompasses any sexual act that's committed or attempted by another person without the freely given consent of the victim or against someone who is unable to consent or refuse. And that idea of consent, that principle of consent, is really at its core. It encompasses both sexual assault as well as sexual harassment in any unwanted sexual contact. Typically, sexual assault has to do with more physical violations and can occur on a continuum, anything from sexual coercion to unwanted touching to rape. Sexual harassment typically has to do with more non contact types of violation, unwelcome sexual advances, gestures, comments, any flashing or exposing of someone else to a person when they don't want that to happen, any videos of a person sent to them without their consent, or videos sent of the victim without their consent, or spreading sexual rumors or sharing sexual details that the victim didn't want shared. And it's relatively prevalent. These numbers here are specific to sexual violence in sport. But if we look at the broader range, it happens a lot more often. And these numbers are on the more conservative side. There are challenges in getting data on occurrence of sexual violence because of a variety of different ways of measuring it, of defining it, as well as just given the topic, there is a lot of stigma around it and taboo, and people may feel uncomfortable talking about it. And so there is concern that the numbers may be even higher than this. The US Center for Safe Sport put out a report in 2020, which found that close to 10% of athletes surveyed reported inappropriate sexual contact during their sport, and 3% of those reported actual sexual abuse. About half the time that occurred at the hands of a coach, administrator, or trainer, someone in a position of power. But it's also important to note that about half the time that occurred from a peer athlete, and that is something that's not always thought about or publicized quite as much. Back a couple of years ago, out of the University of Washington, they did a study there that surveyed Division I athletes, again asking about experiences of sexual violence, and found that close to 30% of Division I athletes surveyed during that study had reported some type of sexual violence during their college years. And the World Players Association back in 2021 put out a report where they found that 13% of former elite athletes reported sexual abuse at least once as a child. There is concern that there is an increased prevalence of sexual violence in sport amongst female athletes, those with disabilities, those that are part of the LGBTQ plus community, and at higher levels, more elite athletes. Though again, there are a variety of differences in definition, this can be hard to know for sure. It's important to know that a type of sport, the amount of clothing and the amount of touching that occurs in a sport has not been associated with increased risk. Though we do know that a lack of protective policies, increased athlete vulnerability, which can do with age, maturity, or power imbalances, as well as less supervised environments, does increase the risk for sexual violence. This is a model for non-accidental violence, including sexual violence, that was published in the International Olympic Committee's consensus statement on harassment and abuse and non-accidental violence in sport. And it's an important point to start from in understanding where the potential for non-accidental violence occurs. Typically, this is rooted in discrimination, which is based on power differentials. It can be for a number of reasons, as you see here, which can lead to most commonly psychologic abuse and harassment as a starting point, and then potentially resulting in physical or sexual violence. And that's the core of all non-accidental violence. It can have a significant impact, of course, on athletes, both physical, leading to chronic illnesses or chronic injuries, GI issues, potential increased risky sexual behaviors or substance use, and then also psychologic impacts such as PTSD, increased depression, increased anxiety, potential suicidal ideation or attempts, and decreased satisfaction or ability to feel comfortable with relationships. There can be a significant economic loss to individuals. And then it's important to think about, of course, the individual who's impacted is first and foremost here, but organizations can lose a lot too if this is occurring beyond just the social and ethical implications. So, what can we as the sports medicine team do in these cases? In the rest of the presentation, we're going to go through a couple of different models and components that I think of in how we as a sports medicine team can respond. And that is based in prevention, identification of sexual violence when it is occurring, and in responding. So, starting with prevention, when thinking about prevention, it's important to consider the enabling components that can occur. And those specific to athletics can include power imbalances that we've talked about a little bit before, which can be for a number of different reasons, but especially in athletics, there can be some hierarchy, both between peers with maybe a more senior athlete and more junior athlete, but then also, of course, with coaches, with medical staff, and various different members of the team. Jennifer earlier mentioned grooming as an important thing to consider when learning about sexual violence. And this is a series of manipulative behaviors that occur to try to gain trust or compliance of an athlete and oftentimes their family as well. And this often occurs before any abuse occurs. The goal of it is to try to make individuals fear reporting or feel like they won't be believed if they were to report. And oftentimes it has to do with someone blurring professional boundaries with making exceptions or making an athlete feel extra special by making those exceptions in a way that changes that professional relationship. Isolation can occur as a result of grooming as well. It typically has to do with increased secrecy, seeing an athlete after hours or in isolated spaces, and then not adhering to standard protocols such as wearing gloves, advising athletes about their rights and obtaining appropriate informed consent. And inappropriate relationships, personal sharing beyond kind of in an inappropriate way in a professional setting are all enabling components. There are also a variety of different components which are more social in nature. Alcohol and drugs, of course, and various substances can make consent harder to give, and there's less clarity around consent. It can also lead to blurring of professional boundaries if someone has drinking more or had more in a professional setting. Societal pressures, that is something that, especially in sport, can be prevalent. There is still oftentimes an athletic team culture of silence. Potentially, even if someone sees something concerning happening, they may feel pressure to not say anything because of concern of how it might affect the team. We've talked already about power imbalance that can occur. And then the bystander effect. The bystander effect is the inhibiting influence of the presence of others on a person's willingness to intervene if they see someone in need of help. And an example of that would be someone seeing maybe an individual acting inappropriately, sexually harassing another individual, but because they're in a group, potentially at a party or something along those lines, they feel uncomfortable intervening, even if they might otherwise intervene if there was just 3 people there themselves and the 2 people that they're seeing this inappropriate behavior occurring. So what do we do to try to prevent sexual violence then? There are a variety of different prevention strategies, one of which is starting with safeguarding policies. And there's a number of examples of this. Typically, the safeguarding policies have to do with creating a social and professional norm that decreases the risk for power imbalances and discrimination, decreases secrecy, and advertises for all to know the standard of care. And so some of those examples include using chaperones for sensitive exams, maintaining appropriate boundaries, avoiding intimate relationships with patients and athletes in between professionals, and conducting appointments in a known space at known times and those standard exam recommendations we talked about earlier. Other policies include those such as the minor athlete abuse prevention policies that the USOPC has published. And a couple of examples of these include obtaining documented consent from a parent or guardian when an athlete is is being treated with athletic modalities or massage, preventing coaches from providing any manual therapies and making sure that that is provided by an appropriate professional, as well as making sure that there is another adult present in the facility and aware of any one-on-one healthcare interactions occurring. These other pieces here, again, may seem like common sense, but are really important to make sure that we're preventing any potential imbalances in power, as well as any potential blurring of professional boundaries. Other prevention strategies include codes of conduct, and the USA Gymnastics has been instrumental in providing great examples of codes of conduct. And this was shared at this past year's AMSSM annual meeting. And a huge thanks to David Cruz, Marcy Foston, Ellen Casey, and Aurelian Ative, who presented on this. And this can serve really as a great example for other organizations. In this code of conduct, there is a lot of various different incredible components to outline what the standard of care should be when traveling with a team. But I'll draw attention to just a few of them, one of which is the necessity of having a separate space for medical evaluation. When traveling, that there should be a designated space, that medical evaluation should not be happening in hotel rooms. Other examples include when dining out, maybe with the team, appropriate use of alcohol and consumption of alcohol in those settings. Further prevention strategies can include something like a Bill of Rights. So this is advertising to athletes expectations of what they are entitled to, again, trying to address that potential power imbalance. We've all been in situations, maybe professionally, maybe socially, where if you're new and you don't really understand kind of what the lay of the land is, you may feel more uncomfortable and you may be less likely to say something. And so having an advertised Bill of Rights of what is expected can be really helpful. This is just one example that is published by the U.S. Center for Safe Sport, which can be posted and available to athletes of what an interaction with their healthcare professional should entail and what they are entitled to during that. And then lastly, education. Part of why we're here, right, is in talking about sexual violence in sport and hopefully helping people feel more comfortable with this, but education at all levels. And that includes with coaches, various different members of the sports medicine team, as well as parents and athletes as well, about what encompasses sexual violence, what are the things that are red flags and potential indicators of grooming, so that everyone knows and understands these concepts. And then, as we mentioned, bystander effect earlier can be something that we want to overcome. And so there are various different organizations, and especially at the college level, where they are implementing bystander intervention training as a way to try to help improve prevention of sexual violence. In terms of prevention, I want to just point out one last thing. The Ralliance report, Ralliance is an organization out of Washington, D.C., which has a goal of unifying sexual violence prevention organizations. And they had put out a report in 2017, which I encourage you to take a look at. And two things that I think are really powerful about that report are their call for an alignment of common standards in these approaches to sexual violence and how we can partner, various different organizations can partner to try to decrease sexual violence, as well as using the assets of sport to end sexual violence. And they lay out a couple of different ways that they see that being a potential. In sport, there are these different components. We have a development system, right? We practice, we do repetition, and you learn values and skills through sport. So how can we harness that to help increase prevention of sexual violence as well? As well as in sport, there is a culture of modeling, right? We look up to various different athletes. And so how do we use that modeling as a way to model healthy relationships, healthy values, and norms? So I really encourage you to take a look at that. So moving on to identification. If you're concerned about someone experiencing sexual violence, how do you identify who that might be? And it's really important to note that there is not just one or a few indicators that someone has experienced sexual violence. Although we're going to talk about some potential things that might bring up a flag in your head, it's important to note that this is not always going to be the case. So there are a variety of different physical and psychologic potential symptoms of sexual violence. And these can make you think about asking more questions. So someone may present with increased unexplained injuries, more frequent STIs, if someone has an unexpected pregnancy, if they have a uterus. For those who are having increased stress-related symptoms, frequent headaches, sleep disturbance, fatigue, GI symptoms, or perhaps you've noticed a sudden change in their mood. They have new or different fears. They have decreased self-esteem, or they've lost enthusiasm for their sport. This may be a good time to ask about potential experiences of sexual violence. And the USPSTF does recommend screening for sexual violence as well as intimate partner violence among reproductive age women. But unfortunately, this isn't always occurring. Less than half of those in this study, college women in this study, reported that they had been screened for IPV, intimate partner violence, or sexual assault. And in a further study that we did during my time at UCLA, in our survey of college athletes, we found that only 25% had reported any past screening for non-accidental violence, including sexual assault and sexual harassment. And so only 22% reported past screening for sexual abuse and 21% for sexual harassment. And although there are recommendations for sexual assault screening among females, there was no difference in our sample between males and females who had been previously screened. The American College of Obstetricians and Gynecologists, in their committee opinion on sexual assault, recommends the SAVE model as one way to consider screening for sexual violence. They recommend screening all patients, and of course, they are more oriented to those with a uterus, but that is certainly something where I think across genders and sexes we should be screening. They recommend asking direct questions in a non-judgmental way, validating the patient if they choose with whatever they choose to share, and at the end, evaluating for any ways that you can help the patient, offering education to them, and helping connect them with the appropriate resources. Unfortunately, there's not a lot of data out there on how best we should screen our athletes. And that is something that in the subcommittee and various components of AMSSM, I know we're working on trying to get a better sense of. In our study, which was just published this month, we went through and asked athletes about their opinions on best practices for sexual violence screening, hearing from individuals themselves. And a couple major themes that came up included allowing a sense of control of individuals for when they choose to reveal or decide to trust an individual and disclose an experience of sexual violence, building trust both through components that an individual may be responsible for, that they are knowledgeable about what to do in a situation where someone has experienced sexual violence, that they build rapport and that they have some type of shared experience, as well as environmental components. So thinking about the timing and the context of asking those questions and thinking about creating an environment that allows for some privacy. They also noted that it was really important to offer multiple opportunities for discussion or disclosure. So not just asking maybe one of these questions at one point, but rather if there is a high suspicion for it, asking it at various times when felt to be appropriate, in case someone may feel more comfortable disclosing at a later point. And then lastly, athletes reported that they wanted members of the healthcare team to initiate the conversation, to actually ask directly about a potential sexual violence experience, because it can be more intimidating to have to reveal that without being asked potentially. And so here are some sample screening questions that is recommended in that committee opinion. These are ones that I think are relatively broad, so they can encompass a number of different experiences, yet also narrow enough to know exactly what is being asked in that moment. So finally, moving into response. If someone does disclose a sexual violence experience, how can you feel confident in responding to that in a way that is sensitive to the person's experience? And that's so important, especially if we are going to be increasing screening. And it's important to note that as physicians, there are going to be two parts of our response. There's going to be the individual part, and that may have a couple components in it. That may be related to personal experiences in the past, as well as your professional identity and professional responsibilities, but then also that there is some component that is institutional as well, as a representative of the institution and in ensuring that the individual is connected to the appropriate resources. And if there's nothing that you take away from this talk, except for one thing, I hope that it is this, that if someone reports an experience of sexual violence, that you listen with empathy and that you provide support to that individual. There is always going to be time to look up to what to do next, but in that moment, if someone chooses to disclose, those are the most important things that you can do. It's important to listen. There is some reason that that individual has chosen to share it with you at that point. And so taking the time to connect with them on a human level can go a long way. It can be helpful to say things like, "It took a lot of courage to tell me that. Thank you for trusting me with that information and being willing to share that information." And letting them know that you're going to be there to help them through this, that you're going to be there to support them. And from that individual response, that's positive, beyond just that positive support and validation, trying as much as possible to avoid judgment, being a little bit careful in potentially what language you're using, and acknowledging that this is not, you are not asking questions because you are trying to understand the truth behind something or exactly what happened. Those are things that you want to, that is often best left to other individuals that are going to be parts of the response. But you want to be asking questions only so far as to obtain the necessary information and know how you can be supporting that individual. And a really important thing at this point in a conversation is to discuss those confidentiality limits. As Jennifer said earlier, and we're going to talk about in just a few minutes, there are components that of being a mandatory reporter where there may be things that you do need to report and that you cannot keep completely confidential. And so discussing those with the athlete ahead of time, make sure that they understand that, and then can help build rapport and a better understanding moving forward. Next steps would be acknowledging your role. We talked earlier about how really your role in that moment is to support that athlete and try to help evaluate needs in that moment so that you can help get them to the right people. You can ask them, how can you help? What are they hoping for support for? They may not know, and that's okay. And you may not know what to do next, and that's okay as well. But at least gives you a better understanding if there are specific things that they have thought of in that moment. And then being very transparent about what the response, what those next steps are going to be, what you're going to be doing next, so that there is clear communication and understanding across, making a plan together for those next steps. And part of that response, there are a number of different categories that can be part of that response. Oftentimes, there are going to be components of the medical concerns. Those can be things that you do evaluate the individual for, any emergent or urgent medical needs, such as heavy bleeding, such as significant trauma, any head trauma, any loss of consciousness, potentially if they assessing if they have any suicidal ideation or feel at risk. Either depending on your practice, you may choose to offer things like STI screening or post-exposure prophylaxis for HIV, for STIs, or for pregnancy prevention, or you may choose to help connect them with an individual who may feel more comfortable with that. And then offering potentially, depending on the timing of a sexual violence experience, a SANE exam. And a SANE exam is collecting forensic evidence, typically swabs and photographs by a trained nurse, and documentation of a victim's report, which can then later be used as evidence in a legal case. Deciding to go through a SANE exam does not mean that an individual is required to make a case, but it can provide more information and evidence going forward, and there is a time limit oftentimes on it. Other parts of the response can include psychologic components, so providing crisis support, connecting them with resources there, that may be with counseling, that may be with medications, as well as making sure that they have some social support as they're going through this. And then, as Jennifer mentioned earlier, some of the things that people feel most uncomfortable about are the potential legal components of this as well. And there are a number of different pieces of this to consider, including mandatory reporting, which we'll go through in a minute. There are a variety of different components which are going to be specific to organization and to state. And so knowing your own states or organizations specific legal response is really important. The athlete may decide to get law enforcement involved and make a police report. They may just decide to seek legal counsel, and it may be important to notify specific members of an institution or organization depending on the rules within your institution. Some of those examples of mandated reporting, as physicians, all of us are mandated reporters for child abuse. So if the victim is a minor or if they're a vulnerable adult as well, it is very important to make a report. And typically that report has to occur both to law enforcement as well as to Child Protective Service or the Department of Family Services. Many colleges have requirements for Title IX reporting and for the Clery Act. And so understanding who, if you are a college physician, team physician, who you need to be making that report to is essential. And if the perpetrator is a healthcare professional, it is important to report any potential sexual violence that they have perpetrated to their medical licensing board. In these mandated reporting instances, information that you would be asked to provide would include the victim's name and their contact information, what was told to you or what you observed, and any information you may have on the abuser. Giving your name and your contact information can then allow them to follow up with you later on if they have more questions. And this is part of where sharing with an athlete that for those mandated reporting components, you are required to give this information is important so that they're not caught off guard. It is always up to them if they would decide they want to talk with them any further when contacted. So beyond just this individual response, which we've gone through, we also have a potential role to influence the systemic response that occurs. And the ideal is that there is comprehensive support that is provided to survivors of sexual violence, that it is multidisciplinary, involving professionals from multiple different areas, that there is coordination to avoid re-traumatizing survivors, and that it protects and empowers survivors. And then most importantly, that there is follow-up maintained so that they don't feel like they get support in the immediate aftermath of an experience, but then may not get it after that. And despite all of these best practices that we've gone through here, there are many reasons that people don't report and don't disclose. And most of these have to do with fear of not being believed or that no action will be taken after disclosure. Sometimes they may not know where to report. And these are ways that we can help influence some of the culture around sexual violence to try to decrease some of these fears. There's also a fear, of course, in the impact on athletic career, potential fear of retaliation. And again, hopefully we can influence changes in ways that make this fear much less and that this is not occurring to individuals. Because really, it's going to be about creating culture change. We have a responsibility as individuals to learn what we can to support survivors of sexual violence. But we also have a responsibility to try to help influence the organizations that we're part of to try to improve how we are supporting sexual violence survivors. And we really want to empower individuals to act with courage despite some discomfort around this topic. And that can be in a number of different ways. And I hope that some of the things that we've talked about today help you feel more empowered to do so. To end this part of our talk, I'm going to just give you a couple of resources if you do want to continue your learning. The U.S. Center for Safe Sport has a really wonderful module that Jennifer mentioned earlier that AMSSM was involved in creating for healthcare professionals. It's 90 minutes and a really great broad overview of responding to sexual violence and risk factors for sexual violence. I encourage you to check it out. They have a great resource list, which can be accessed at any time and has a number of helpful resources if faced with an athlete who has experienced sexual violence. Other organizations and resources that I encourage you to check out is the World Players Association put out a handbook in 2021, which is a really valuable hands-on guide for how to take care of athletes who have suffered effects of trauma or abuse or harassment in sport, and is written from a perspective of athletes themselves. And then lastly, the Army of Survivors, which through AMSSM and the CRN, we have been working with, was founded back after from survivors of the USA Gymnastics and Michigan State University physician who sexually abused hundreds of female athletes. And there are a number of the survivors from those experiences who founded this national organization who works to bring awareness and accountability to sexual violence against athletes. And they have a number of wonderful resources, so I encourage you to check out their website. So I hope that you have taken away that unfortunately sexual violence is prevalent. It can affect anyone. There is not one picture or one indicator of a sexual violence survivor. It's really important that we take a multidimensional, multidisciplinary approach to prevent, identify, and respond to sexual violence. If we can intervene early, we can decrease victimization and improve mental and physical health outcomes. And there is a huge need for us to continue efforts around improving supportive environments for survivors. And this is a quote from the most recent PPE monograph that encourages physicians and healthcare providers during PPEs to evaluate for sexual violence. But it tasks us that sexual violence is not going to be discovered if the question is not asked. So we need to be asking the question and increasing our index of suspicion to ask about this. And lastly, I leave you with this quote that was published in 2021 in a Patient Voices article in British Journal of Sports Medicine from a member of the sports medicine community who has been impacted by sexual violence. And although today we've gone through a number of safeguards, policies, and we're working on education, which are all important components, really, as this article points out, it really is going to take a commitment from us as clinicians to be willing to be vulnerable and to connect with our patients. And so I hope that you feel inspired to do so and help support survivors of sexual violence. Thank you very much.
Thank you, Sherilyn and Dr. Koontz, Dr. DeStefano and Dr. Koontz for doing that lecture and for speaking on this topic. It is a very important topic. It's a difficult topic. And we as sports medicine physicians have played a difficult role in the past, and it has to be acknowledged so that we can move forward. Dr. Koontz, you kind of led us off with some of the plans that AMSSM has. Do you have any thoughts or comments on what Dr. DeStefano was just mentioning?
Yeah, thank you so much. And thank you so much for that great talk, Sherilyn. It really did a great job of an overview of the entire topic. Um, yes, I'm really glad that she shared resources at the end and just acknowledging that there's a lot more work to do and less an ongoing amount of work to do that we all are committed to. I thought maybe I might spend just a couple minutes kind of going over the detailed topics of the sports medicine education topics that we committed to in the position statement. And Sherilyn really touched on, I think, almost all of them, but just to let you know, um, and if you go and read the article, you will see these as well. But at the end of the day, we want all of sports medicine physicians to be able to know how to, well, number one, be able to know how to partner with those in your community. So that might be administrators in your hospital, other physicians. But then we also, most of us live in this world of high school and um, collegiate settings. And then professional and elite sports is an entirely other topic as well. But every single one of those entities have their own culture of leadership, bureaucracy, administration, policy, and they all exist at different levels. So there's that have not only policies and at those institutions, but there might be city laws, county laws, state laws, federal laws. There may be international aspects to look into. And all of those are really important. And most of us as physicians are not legal experts. And so it can all be overwhelming and almost paralyzing. But one of the things we want to do is to, um, for those in team physician roles, to be able to understand how to partner with community leaders, legal advisors, administrators, to be able to not only put those safeguarding policies in place, but understand how reporting mechanisms should work, and once an incident does apply, kind of how it's, I guess, case management procedure is the term that we used, but then also to put in prevention policies in place. So I just think we're all in a position to be able to do that. And so we first have to, kind of have an idea how to do that, and then be willing to take that next action step. Two, I think just knowing how to prevent sexual violence. And as the IOC international position statement pointed out very well, and Sherilyn shared that very classic graph of all types of non-accidental violence, even outside of sexual violence, they all work together. And it's good for us to understand that physical violence, psychological violence, all of that contributes to the concept of sexual violence as well. And so we need to understand what bystander prevention or bystander intervention training prevention programs are. We need to understand what grooming is. All of those can go so far in teaching our athletes how to advocate for themselves. It doesn't mean that there won't be continued victims, but that's the first step in advocating for that. Um, Third, just establishing in our own spaces and the athletic trainers that we work with, the schools that we work with, our own clinics, examination and treatment policies that just reduce the risk of sexual violence. Next, we need to understand what those signs and symptoms might look like. As Sherilyn very accurately pointed out, very few people want to talk about this and share that this happened to them. There's a lot of guilt and shame that we need to help normalize and empower the normalization of reporting and sharing. But in the meantime, there are signs and symptoms and different health consequences that can cue us into the fact that sexual violence may have occurred. So we want to make sure that everybody understands what those are. We need to be able to implement and have in place before it ever happens, kind of a treatment guideline that involves the multidisciplinary team, where that entire team is kind of established and knows how to work together. One of the biggest things is that we should know how to do right away. And unfortunately, it's not necessarily standard in medical education right now, but if a patient discloses that a sexual violence took place, how do we respond? What's the appropriate way to respond that lets the patient know that we are their advocate, we are there for them, we are going to help them not get hurt by this anymore and help them recover. And so we need to know that before it happens. We need to be ready. You can't say the wrong thing, not to put pressure, but if this happens, we need to be prepared for that, and just understand the confidentiality around that. And like I said, the legal reporting mechanisms, it's very clear if someone's a minor, we of course report that. That's very clear. But what happens if a survivor or one of our patients is not a minor and doesn't want to disclose? What do we do to handle that? How do we keep other people in that same program safe? How does that all go into that? And Sherilyn mentioned Title IX and the Clery Act, and most of us are not experts on that either. But it's important to know the Clery Act is an act that involves like reporting of statistics, and a lot of us have an idea of what Title IX does, but in most collegiate settings, that's where sexual violence reports go through and get processed, as opposed to outside police entities. And a lot of people think that's a problem, but it's important to know that Title IX also applies to K through 12. So if you're working with high schools and younger athletes, know that Title IX impacts beyond the collegiate setting. And then the final item that is listed is just emphasizing peer accountability. And if we suspect that a colleague is a sexual predator or perpetrator, we must report that. And we have to know how to do that. Is that law enforcement? Is that to our state medical board? Is that to a supervisor? It's not our job to decide if they're guilty or not. But if we have legitimate suspicion, then we have to turn that over to people that know how to investigate that further. So yeah, I will just leave it at that as for now, and see if there's any other questions to go over.
Thanks, Jenny. That was a really good summation as well. And I think the bottom line is, what do you do? What do you do when you're in those rooms? And how do you make sure that people feel comfortable talking to begin with? But also, like you said, prevention is the most important thing. So how do you make sure you're keeping an eye out for things, regardless of which athletes you work with or which patients you work with? Sherilyn, do you have any like examples of, specifically for our fellows who, this is a difficult topic to get comfortable with, especially when you're learning everything else and you're trying to figure out how to ask somebody questions if they have neuropathy easily. So, how do you have any tips that you give your residents or fellows when you're going into PPEs or that sort of thing? You gave some really good kind of like last minute things to think about and kind of some wrap up points, but do you have some just tips and tricks for people to just start to kind of get comfortable?
I think one of the most important things, and Jenny alluded to this as well, is just in normalizing the conversation, right? And it can feel really uncomfortable, but it's really with practice that it's going to feel more comfortable to you. And as a sports medicine community, I'm really excited that we're presenting this to our fellows now, right? And hopefully encouraging education at that early level, because then it's just going to become more normal to ask about it if you suspect sexual violence, or potentially during PPEs as well. So I think one of the things that can help just make it a little bit more comfortable is just introducing it before just coming out, right, and asking about it, right? Potentially just giving a little bit of a prep of, this is something I ask all of my athletes because we take this really seriously. That can help you feel a little bit more comfortable and hopefully help the athlete feel more comfortable in that as well. And I think just thinking about connecting on a human level, again, it's not doesn't, you do not need to know all of the right answers. There are many resources out there that you can get and find the right information out there. But it's really about that initial response and just really diving back into the reason maybe you went into medicine, about trying to connect with people, right? I think that's really where it's at its heart.
Yeah, that was a great way to end. Well, I want to thank you both for your time and your expertise. Rosemary just made a quick comment. In Washington State, all the high school coaches are checked for any history of criminal behavior. Yeah, and I think not all high schools do that, and we're talking about people even younger than high school too sometimes. So things to think about, and history of criminal behavior doesn't always mean there's no potential for misuse of their position too. So it's good to have that, but certainly we want to keep that in mind. So with that, we're going to stop the recording, and thank you guys for your time. And if you have follow-up questions, you're always welcome to reach out to Dr. Koontz or Dr. DeStefano. And also you're able to rewatch this recording if you feel like you missed anything or you want to get a refresher course before you start your PPEs in a few weeks.
Thank you.
Thanks, everyone. Have a good night.